Nikso kuaukak, nisto kouk Makiinima, kitkonäksumat se puan huaksista kuikak. Ne maat sko tohpinna naamu, kaamui maanaapistut sispii tohkanaappi. Hannimäen hukka imatapiksista ja mukska setapiks. Setapiks, ki kekaamata pakkaimman hukki tuiksi. Kenne setannista ja muuksi mahkotuuksi, kääksouki muuksi aapoutomuukiksi. Hässukinakiakiksi, ouki aamuksi nistä skai itaapoutakia muskaa kakkumaa setannista ja nikä samuannista ja nuhkaa stojia. Niin taapoututtama pion kaksiksistutsi. Hakavaanikkien homuksi ässukinakiiksi, niin taapoututtama pion kiistonnoon nakumata piksistuutsi. Hukeen alkanista kuttu muut saakka tuhpaan kistaisen juutspi. Nuhaan kitaa iskiiska mani passimiis. Houken nyt setannista ei mohkutuuks, kääks setannista ja ei komaa uututama pintaa kuhkimanisto. Käätä piis käännä iksestääks tääkitä mitsi kristuukunisto. Oikein niikseen hauan ja saa kitääkstä mikristuussa saa tääkupuhkua ja uutta piissen. Kuhtuptista piitsemä ja mä en stuututama pihpi. Hammuh kaksi kristuuts. Ken okei. Hän muuksi puukääksän hohuttamata piksistä ja kenneet sytännisiksen kekään, niikseen tähkitse nääkse puja. Tää kun katsotaan kristuukuukin. Ja mä skuutuhpinnään, niin kääksestuukuun niistä. Kiputsi se kanssa kitaakseen napskuhpinnaan, mä en stuututama pihpi. Niin käsistä se kuhkimanisto. Aamukseen neksäskään hummahkita piiksä keittaa puutatska käytä pien huiksestääks. Hännekseen puukiaan ikkuksen ja maatsi kun äksestui itse maatsa. Aksiksestassa. Kenno kaikisi koksii kahkimin pua. Niksukua. Tämä paakutui kristuuts paakutsi. Kistua kitaakuksi kammutahpa. Kiu äättäpiu kään nauttua nääkammutau. Pikuutu tamappi. Kenneekin ohannisi kahkimin pua. Niksukua. Tääkätsi poja musta skemmatsikien haamusti. Nyt käy pääksymäkinä kuin taisseta pio. Pääsukinakiäkiksi taisseta pio. Aamukseen niikäs käy kiksukuonnoon. Pukavat tuumaja. Indigena capital. Hänneksi käy spommuukia. Pukaan puutakin ja muuksi ja siksi käitseta pio. Niikseen ohatseta puutakin. Oikein mahkaa. Nippitää makstahtista jääkin, no hatsetsen spumpstaa. Hänniks käy, stamittukaksi matsia aamuksi niiks käy, niin sen isketä Mark's Work Warehouse. Ki muuta pitsiä si kohkutuki muhkin, se hän nimeitä ei taapeskatakia. Hänniks käy, uustuja uutavat skaataksia, sokskaataksia, itania, keka. Ahki pspummua siksi keitsutappi, ahki pspummua käännä. Hän iskäjän kaamuskeista kukkia aamusta. Niin tapakoja on miksi äskeini maatsääkseni ei katso psukaappia. Ei katso psukaappia. No kun muu saaktumanista aissat, oikein muu saaktumanista. Kenneekin uhannista vai ei komannista käytä pian kasvumuukiksi animia. Hän ikäikiistonnoon. Ikäikiistonnoon niitä puututama piikiistonnoon akavatspummuuksuus. Aksiksistuus. Hän. Onko ne taksaa piipui? Thank you for being with us today. I wanted to share some comments with you with respect to the pandemic. With respect to the measures that we are taking in order to ensure that we can defeat this virus as much as possible. At the outset, of the availability of vaccines for us, we all knew the importance of getting vaccinated. And so I had made a commitment to our council, our staff, to our membership, that I wanted to give that opportunity to every other member of the tribe to get vaccinated before I received my vaccination. So many of our people have been vaccinated so far. However, there is still a segment, a portion of our population that have not come forward. It's important that we all get vaccinated, not only to protect ourselves, but to protect the membership of the tribe. And so I have told everyone that now that we are able to vaccinate our young people, 12 and over, that I will join them in being vaccinated. We have enough vaccines to go around, but we don't have enough of our members getting vaccinated. So if our young people realize the importance of getting vaccinated, then we should all learn from them. I wanted to also share with you some of the contributions that others have made towards our safety against the virus. Several of them include Indigenous Capital. They helped us with some initial resources for food and other essentials. They have provided masks for us, not just ourselves, but the other tribes of the Blackfoot Confederacy. And so they have also worked with Mark's Works Warehouse. Mark's have stores all over the place. And as well, they worked in conjunction with the Blackfoot Confederacy, the education department. And Mark's Works Warehouse has donated 184,000 medical face shields. These are the plastic coverings that doctors and nurses wear. They're medical, they're of high quality. So they have donated that to us, more specifically for our students, but for all of us as well. And so we are sharing those with the other tribes of the Blackfoot Confederacy. We are also sharing them with some of the other tribes within the Treaty 7 area, as well as some in southern Saskatchewan. And of course, we want to thank Mark's Works Warehouse for the contribution that they have made. We want to thank the hard work of Indigenous Capital and the Blackfoot Confederacy and our people, our departments, for ensuring that we get this extra protection, especially for our young people. So whenever school resumes, they will have this extra protection. And so I wanted to share that with you. Today, this week is a very special week. It is Nurses Week. It's a very appropriate time for us to thank our nurses for the hard work that they have done over the last year and a half or so. Not just our nurses, our doctors, our medical professionals, our frontline workers, people with our administration who have, continued to provide us with essential services. Those other departments that we work with, the health, education, our police, of course, our own social development departments. We appreciate the good work that has been done. And I was just telling Pam before earlier on that we still have that principle of helping each other, especially in times of need. So we are not only undergoing this pandemic, we are also battling the addictions problem that has been with us for the last few years. So we have many of our people have gotten together. They're working collaboratively against the spread of the virus as well. Another group is working against the awful drug addiction problem that we have on our reserve. If you look at it, if you look at the figures, we actually have lost much more people as a result of drug addictions than we have as a result of the pandemic. It gives us some perspective. So it's important that we are doing whatever we can collectively, collaboratively, to fight against the pandemic and the addictions problems. And it is at times of need where we really begin to see that kimmapipitsen, akustuapsen. Those are important principles. We have this empathy for our membership, for each other, as well as we are prepared. And we have taken on the task of overcoming these problems. Perhaps the problems we have with addictions will take longer than the problems that we suffer with by way of the pandemic. But so long as we continue to respect each other, to work together collaboratively, and so long as we take on that task, so long as we accept that challenge of defeating the virus and eventually defeating the drug addiction problem that many of us are affected by. I wanted to thank everyone concerned. Our council continues to negotiate with others in getting more resources, not just for the problems that we have, but for other matters. We have been able to acquire more resources, say, for housing. We have a rapid housing initiative as well as our regular housing, and of course we will be informing you on the possible settlement of the cattle claim. There is going to be an information sessions, many sessions, so that you will become aware of the recommendations with respect to the settlement of the cattle claim and how we ought to use the settlement dollars. So that is going to be that's going to take place, begin shortly, and we want to make sure that everyone is fully aware. There was another smaller claim that we have been working on over the past few years, couple of years. It's called the top gas claim. And I think we've reached settlement with the federal government. Council has looked at it, has accepted the recommendation, and we want to have that completed fairly soon. But we will keep you informed on that as well. We will set money aside for housing, set money aside for investment for future generations, and of course, money set aside for distribution. It's not a whole lot, but you know, we want to keep working on those matters that would be beneficial to the membership. So I don't think I have too much more to add to today's message. I want to thank everyone that has been involved in combating the pandemic as well as the drug addiction problem, and thank all of you, Ghana, for your commitment, and we'll get out of these things and we'll be much stronger. Thank you very much.